Hello everyone. In this session, I'm going to cover a spectrum, that is disease, impairment, disability and handicap spectrum. These are not synonyms. There is a difference between them. Now, what is the difference? What is the definition and difference between them? So I will explain you the entire spectrum, how disease leads to impairment, impairment leads to disability, and disability finally leads to handicap. What is this spectrum is about? I will tell you the definitions along with example. So let's start it. So let's start the spectrum, that is, you can see here, disease, impairment, disability, handicap spectrum. So let me tell you the definitions first, then we will see an example and understand it again. So what is a disease? Let's start with disease. What is a disease? Any abnormal condition of an organism that impairs the function of that organism, that is known as disease. What is a disease? Any abnormal condition in an organism that impairs the function of that organism is known as disease. What is impairment? The loss or abnormality of physical, loss of any anatomical structure or abnormality in physical or psychological structure. You know, in body we have what structures we have? We have anatomical parts, we have physiological functioning, we have psychological functioning. So that's the human body. So if there is any loss of any anatomical structure, some injury is there, some anatomical loss is there, or there is impairment in the physiological or psychological function, that is known as impairment. Okay, so there is a difference between disease and impairment. Disease is any abnormal condition in human body. Any abnormal, learn the terms. Any abnormal condition is disease, but loss of anatomical structure or impairment of psychological and physiological functioning is known as impairment. What is disability? Because of the disease, the person have impairment. Okay, because of the impairment, the person cannot perform any activity which is considered normal for that person, right? Because of the impairment, the person cannot perform a activity which is considered normal for that particular function, particular human being. That the peer group of that human being can perform that activity, but this person cannot perform because the person is having impairment. That is meaning of disability. Now, because of disability, the person get a disadvantage in the society. The disadvantage given to this individual resulting from impairment and disability that limits the fulfillment of the role of this person in the society, that is known as handicap. Better to take an example and let me explain you. Disease lead to impairment, impairment lead to disability, finally disability lead to handicap. What do you mean by that? For example, there is an accident of a person. Imagine there is a person healthy, the person have an accident. Accident is not a normal condition, it's an abnormal condition. So I consider the accident, because of the accident, whatever happening in that person, that is a disease. Okay, now in that accident, the person unfortunately lost the foot. So lost the foot, loss of any anatomical function, or there is impairment in physiological or psychological functioning, that is known as impairment. So disease leads to impairment. Because of impairment, no person cannot walk, but other people of this age group can walk. But this person, the walking is considered normal for this person, but whatever is considered the activity normal for that person, the person cannot perform that activity. Inability to walk is disability. So loss of foot, the person cannot walk now because the person is amputated, loss of foot. So that is disability. So disability is inability to walk. And because of that, the person loses the job, right? Because of inability to walk, the person is getting a disadvantage in the society, right? So the person cannot fulfill the role in the society and the person loses his job. So unemployment is the handicap. So inability to walk is disability, but unemployment is handicap. Please mind it. Please mind it. I'll repeat my terms. The accident is a disease because it impairs the function in a person. Because of the accident, there is loss of foot, right? So loss of foot is impairment, loss of any anatomical structure or any impairment in physiological or psychological functioning. So the accident leads to loss of foot, that is disease leads to impairment. So okay, you compare. Now because of which the person cannot walk. The person cannot walk, that is the disability. You know, the walking is considered normal for this person, but now the person cannot walk. So anything which is considered normal for that person, the person cannot perform that activity is known as disability. Okay, so impairment leads to disability. Finally, the person loses the job, right? Unemployment. That is considered as handicap because loss of job is the disadvantage given to this individual because the person cannot fulfill his role in the society, right? So that is the handicap. You got my point? So I request you to learn the four definition: the definition of disease, the definition of impairment, the definition of disability, disability, and finally the definition of handicap. I request you to learn that. Now I help you in revision. Disease leads to impairment, impairment leads to disability, disability leads to handicap. Please learn the sequence. You cannot change the sequence. So disease always leads to impairment. First disease will come, then impairment will come, then disability will come, and finally the last is the handicap. So the sequence is DIDH. You never forget the sequence. The first thing, learn the spectrum. Learn the early, learn the late. What is leading to what? And then learn the definition of each of them. What is disease? Any abnormal condition. I will write any abnormal condition in human body is a disease. What is impairment? Disease leads to impairment. Now, because of any abnormal condition, what will happen? Either the person will lose any anatomical organ, okay, or the person will have impairment in physiological or psychological functioning. So either anatomy or physiology or psychology is not functioning properly. So because of that abnormal condition, that is impairment. Now because of that, the person cannot perform the activity which is considered normal for that person. The person cannot walk. Walking is normal for that person. That is known as disability. And finally, the person cannot fulfill the role in society which is considered normal for that person. That is handicap, right? So please learn one term to frame the definition. You cannot learn the definition as it is. For disease, learn abnormal condition. For impairment, learn loss of anatomical, physiological or psychological function. For disability, learn the person cannot perform the activity which is normal for that person. And for handicap, please learn the person cannot fulfill the role in the society which is considered normal for that person. Now give the example. I have given you the example. The accident is a disease. Accident leads to loss of foot. That is impairment. Because of loss of foot, the person cannot walk, cannot perform activity, right? That is disability. And because of which the person loses the job, that is unemployment. So unemployment is unable to fulfill the role in the society. So that is handicap. So please write like this only, the definition, the sequence, the example. So that's all about it. I hope you learned it well. Let's solve some MCQs based on that. Very good MCQs are there. Okay, please see. Which of the following is the most logical sequence? Tell me the sequence. I told you. Is it impairment followed by disease, followed by disability, followed by handicap? You see the 4 options. Tell me the correct answer. I told you to learn DIDH. This is the sequence. Never forget DIDH. What is D? Disease, impairment, disability, handicap. So I guess B option is correct. Okay, disease, impairment, disability, handicap. Okay, coming on the next question. A person who has lost his foot in the accident and now unable to walk. Unable to walk. Is it a definition? Is it an example of disease, disability, impairment or handicap? You decide. The person cannot perform the activity which is considered normal for that person. So what is that definition? Yes, the correct answer here you will say is disability. Okay, if I change the question, currently the answer is disability because the person cannot walk. So person cannot perform the activity which is considered normal for that person. Let me change the question. A person has lost his foot in an accident and person is unemployed now. Now the person, I am changing a word. Instead of not walking, I am using the word the person is unemployed. The person loses his job. Now, is it an example of what? The person is not employed, so person is not able to perform the role in society. So this is a definition of handicap. So I will change one word. Instead of not walking, I will use the word unemployed. So answer will change from disability to handicap. I hope you can understand. So these are 2 different questions in 2 different times, two different exams. So students got confused, So I hope you got it well. So let's have a look on the university exam questions which are asked from this topic. You can get a question on the sequence, to explain the sequence with example. You can get a question on the difference between any 2, like disability and handicap, like impairment and disability. So with the help of example, you can explain the difference between them. I hope this is crystal clear to you. Thank you.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLive by Dr. Priyanka. So join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.